A healthy knee joint is made up of 3 bones. The thigh bone, or femur, sits on top of the shin bone, or tibia. The rounded end of the thigh bone rolls and glides across the relatively flat upper surface of the shin bone. The third bone, the kneecap, or patella, provides leverage that reduces strain on the muscles that are used to straighten the knee. A knee is held together by ligaments and supported by muscles and tendons. These and other tissues envelop the knee, creating what is known as the joint capsule. Within the capsule, a type of fluid is produced that keeps the knee lubricated. The ends of the bones in a knee are prevented from rubbing together by a cushioning layer of tissue called articular cartilage. It's this cartilage that allows the bones to move without friction or wear on the bone surfaces. When the cartilage in a knee has deteriorated due to excessive exercise, injuries, or diseases like arthritis, the bones begin to rub directly against each other, causing pain and making movement difficult. In knee replacement surgery, the joint surface of the thigh bone, the shin bone, and the kneecap are replaced. Just like a healthy knee, these implants have smooth, gliding surfaces that allow easy and painless movement.
In knee replacement surgery, the damaged parts of the thigh bone and shin bone are removed, and they're replaced with metal and plastic implants. The procedure starts with necessary incisions, then precision guides and instruments are used to remove the damaged surfaces and prepare the bones to accept the implants. Then the new implants are put in where the damaged bone surfaces used to be. Once the implants are in place, they are checked, and when the surgeon is satisfied, the incision is closed and covered with dressings.